Let's get the latest now on developments in East London from our reporter Sipha Kema, who joins us live now from the Sisa Tukashe Stadium. Sipha, very good morning to you. Tell us about what we can expect on the program as well.
Well, we're running it behind, Aldrin, behind schedule. By 11:15, the Deputy President as well as Health Minister Aaron Motsoaledi were supposed to have come to receive the memorandum from the Treatment Action Campaign, but they've just arrived. We just want to show you as they're coming in now. We are expecting them to then start making their way inside to the makeshift stage that was done by TAC so that he could go up and accept the memorandum that they're giving now. Just to remind you what exactly is in that memorandum, as you mentioned earlier on, Aldrin, that TAC is actually demanding for 6 months supply for those people living with HIV, those that are eligible, of course, to get onto the 6-month program instead of the 3-month supply. But also saying that, according to them, they say more than 6 million people across Africa who are getting a 6-month supply of ARVs are actually viral suppressed, and it's looking good and positive. So asking why doesn't then South Africa implement that so that they can also lower, suppress the virals within people as well, and also where people don't default because of not being able to get to the clinic, or some of them dreading waiting in those long queues and lines in the primary healthcare facilities where they actually collect their medication. Now also, Aldrin, part of the drive and the work by government in the fight against HIV has seen for the past 2 years a decrease. Now, as of 2022 stats that were released, it was said that 149,000 new infections saw that in 2022, while in 2021 it was 169,000 of new infections of HIV. But it seems that for the past few years it has been on the decrease. Also, we know that doctors have been saying that South Africa is leading when it comes to being at the forefront of the ARV treatment, whereas even the 3-month supply has assisted people so much, Aldrin, instead of them having to get the 1-month supply every single month, seeing themselves having to go fetch medicine at the local primary healthcare. But also some of the people, the issues that they have with people that we've spoken to on the ground, Aldrin, is issues of transport, accessing public transport, but also not only that, but also accessing public transport, but also not having money and being able to afford getting to the healthcare facility. There we can see the Premier of the Eastern Cape as well as the Minister of Health, Dr. Aaron Motsoaledi, coming out waiting for the Deputy President, as he also will be making his way in, coming to accept the memorandum. There we can see the Premier of the Eastern Cape coming to address, of course, the people from Treatment Action Campaign. Premier, thank you so much for joining us on Newsroom. Let's talk about coming here today, of course, to commemorates World AIDS Day. It's the official program is within the Eastern Cape. Stats have shown a decrease as well in the Eastern Cape when it comes to the virus. Let's talk about the work done currently.
Yes, there is the work, quite integrated work, quite comprehensive approach to ensure that we are impactful. You are right, we have reduced the mother-to-child transmission. We have reduced the death-related, AIDS-related deaths in our province. Yes, we still have a problem of adolescents, young girls, as you understand that we are grappling with the high teenage pregnancy also in school. So we are trying our level best also to turn that tide as well. But overall, the work is showing good, and our teams on the ground, Department of Health, against all odds, we are doing our level best to ensure that we save more lives and our people are able to live longer. And we are calling our people to go all out. Those who are on treatment, please don't actually leave treatment. Don't default. Continue with your treatment. No one can die now simply because a person has been diagnosed HIV positive. No AIDS is killing now, but there's no cure for AIDS. That one is clear, but we can only mitigate the effects of HIV and AIDS. through the ARVs and all that. So our people must be on treatment. They can live longer, look after their families and all that. People go to work, still have their careers and all that. So that's what we are trying to do. This awareness are very, very important. We do really appreciate the decision by National to take this program here, the World AIDS Day commemoration. So we do really appreciate it. We don't take it light. It's quite important for us. It is actually amplifying the message of reaching out to as many people out there to make sure that people still take AIDS very serious. We must take AIDS as we did with COVID-19. We fought COVID-19 head on, we tackled it. So that kind of vigor, that kind of energy, that kind of vision, that kind of leadership is still required. We are working with civil society, traditional leadership. Everybody is mobilized, but also families. That's why we are against your pens down thing, activities, all those social gatherings that are not controllable. That also shows some very bad behavioral patterns, problem. But we are doing well as a province, and I can tell you that so far so good.
Premier, I'm aware you have to go, but just one last question from my side. Moluko Mlota here from ENCA. Your MEC has spoken about the fact that you have children aged between 10 and 14 who continuously get to be infected with HIV.
It's a societal problem. It's not only here in the Eastern Cape, it's a national, it's a global issue. It's a kind of a development that our people are actually witnessing across the globe. So yes, in the Eastern Cape, it's also happening. That's why we talk about teenage pregnancy, people younger getting pregnant. This is a problem. People must use condoms at all material times to protect them.
All right, Aldrin, let's just pull out of that where we've just been given an indication that the Deputy President has making his way, including the Minister of Health, Aaron Motsoaledi, to accept the memorandum as we start moving towards the stage, Aldrin, to where we'll be able to clearly see and hear what is being said when Tech hands over the memorandum to the Deputy President. Now, to remind you what exactly it is that they're looking for, they're saying that they are demanding a 6-month supply for those that are eligible, that are living with HIV, so that they don't have to always go to the clinic, and transport being one of the biggest issues, which then of course leads to people defaulting on their medication. Tech says that giving a 6-month supply, Aldrin, will then combat to that issue of defaulting. Here he comes. We can see the Deputy President then making his way to Tech with the Minister of Health, Dr. Aaron Motsoaledi, next to him, as well as